Doctor, I want to ask means a personal question of mine.
Mhm.
Means in my family, my sister is means having periods, but it comes near around a means 60 days in a month, and 3 months in a month, and it comes near around 25 days in a month also. Means it's not
Mhm.
fixed,
Yeah.
right? And if it's the periods comes, right, the bleeding goes for 10 days and 11 days like that,
Mhm. Yeah.
and
How?
yeah, she's only 23
Mhm.
years old. Now,
Yeah.
in this December, she will be 24,
Uh-huh.
and she's
Uh-huh.
having thyroid, doctor.
Yeah. So, we kind of classify this as abnormal uterine bleeding in this age group. So, it could be due to multiple reasons. Is she having regular ovulation or not? Is the question. And then does she have any other medical problems that could potentially impact the bleeding, right? People can have endocrinal disorders like thyroid problems. They can have
Thyroid she's
leptin.
having, as well as we have done a test of sickling. So at that time, she's having sickling, but after that, it's in the normal stage. Sickling we have test another time, but it's normal.
Okay.
Sickle cell,
Oh, sickle cell. Okay.
yeah.
Yeah, yeah. Okay. Yeah. So, and her thyroid was normal, you said?
Thyroid she's taking medicine continuously.
Yeah. And has she checked her thyroid levels recently? Because typically, if you are on thyroid hormone, then you need to make sure that you're checking it every 3 months to
In a
make sure you're on the right
span of
dose.
time we're checking.
Yeah.
Means every 3 months or 6 months we are checking that.
Yeah. I think the next step would for her would be to kind of find out other causes for heavy bleeding. Sometimes you can have a polyp or a fibroid. In a younger patient, I'm not worried about cancer as much. So most of the time, the common culprit in this younger patients are usually they have possibly a polyp or fibroid that is causing the bleeding. So having your see a gynecologist and getting a pelvic ultrasound and a pelvic exam can kind of differentiate what's going on. Sometimes they may not find a exact reason for it in terms of like polyp or fibroid, but still maybe even like putting her on like a few months to of birth control pills to kind of reset her cycles might be beneficial if they don't find any pathological cause for the bleeding.
Okay. Okay, doctor. Thank you for that. So I will also inform my sister regarding this. So
Mm-hmm.